Pediatric Generalized Anxiety in Elementary School Students. Anxiety is prevalent in elementary school students and can have a detrimental effect on their lives. Having a plan in place to help is essential to a successful learning environment. Pediatric Generalized Anxiety Disorder, otherwise known as GAD, is a new issue for elementary school students in the United States, but is still exceedingly prevalent. It has been found that chronic anxiety is the most established mental problem facing youth today. Currently, mental illnesses are considered an important public health issue for reasons that include early age of onset and the potential for negative effects on families, schools, and communities. Pediatric GAD was not considered a mental illness until it was published in the Diagnostic and Statistical Manual for Mental Disorders, the DSM-4. Because of that, students may not have been taken seriously when they came forth with their symptoms. Additionally, students who suffer from anxiety are less likely to succeed in school. With pediatric GAD being a new and growing disorder among young children, it is becoming even more important for us to understand it. What is GAD and why is it a problem? Is there a stigma surrounding GAD? What are the differences in race, culture, and sex? What school and community programs are currently in place to help students with anxiety? Who is currently involved with helping students with GAD? And finally, how can a 5-step process be implemented to diagnose and manage anxiety in elementary school students? Understanding GAD and pediatric GAD. It has been found that excessive anxiety is among the most common psychiatric problems facing youth today. Anxiety is a broad disorder for which the development of a fluid and concrete definition has posed a considerable challenge. Anxiety is definable. However, there are many subtypes of anxiety that have more detail and criteria and therefore need more description. For example, anxiety itself can be described as a set of feelings ranging from tension, frustration, worry, sadness, and withdrawal that last from a few hours to a few days. To be more descriptive, pediatric generalized anxiety disorder can be categorized by noticeable distress and can inhibit community, emotional, and instructive functioning. Pediatric GAD is a distinctive disorder, particularly because a child who suffers from GAD was not able to be diagnosed properly until the DSM-4. GAD is also distinctive because it is characterized by uncontrollable worry, physical symptoms, and due to the fact that it can affect over 10% of adolescents, mainly starting around the age of 8.5. Since GAD is a disorder that very well may affect elementary school students, it is important to understand how it can affect them in a classroom setting. GAD can affect a student's academic achievement, their social skills, and their social life. Youth who suffer from GAD may potentially seek constant reassurance and may respond poorly to any criticism. Another common sign of a student with GAD may be a constant fear of stormy weather, fear of becoming ill, and the fear of an uncomfortable or risky situation, as well as the fear of the future. It is not rare for a student who is trying to manage their GAD to hide their symptoms. Students who try to hide their symptoms may exhibit a different set of symptoms altogether. These different symptoms may be presented as a constant need to be perfect, a fear of homework assignments, anxiety centered on tests, and sensitivity during communication with others. The classroom symptoms are a little different for GAD. Youth who suffer from GAD may also have many physical complaints. These physical complaints may cause disruptions in family and peer interactions due to the fact that these complaints may not be taken seriously or may be mistaken as an illness, such as a cold or a stomach flu. These symptoms that students with GAD experience are often referred to as somatic symptoms. This means that when a student states they are frequently suffering from stomach aches, the sweats, and the trembles, it could in fact be anxiety. It has been found that students who suffer from somatic symptoms such as these are almost 5 times as likely to test positive for anxiety. Even though pediatric GAD does affect over 10% of youth, including elementary school students, GAD is highly underdiagnosed due to numerous factors. One factor contributing to underdiagnosis is that anxiety can be common in young children, and schools may not have the authority to run a clinical test or may not run one until a student is brought in for frequent somatic symptoms. The second reason GAD can be underdiagnosed is due to many related illnesses, such as depression, obsessive-compulsive disorder, and other phobias. GAD is not only hard for elementary school students to manage. Elementary school students grow and become middle and high school students. It is important to remember that these elementary school students with untreated GAD can potentially develop their mental illnesses as they get older. Since 14.2% of high school dropouts and 4.7% of high school dropouts deal with a mental disorder, such as GAD, it is important to implement strategies at the elementary school level in order to lower the dropout rate and help students become successful adults. GAD can involve into more extreme anxiety or mood disorders in adulthood. If there are proactive programs set up, it is likely that the rate of high school dropouts and college dropouts will become lower, and the students will not go into adulthood with more extreme mental illnesses. The stigma that follows GAD. Stigma refers to a destructive approach or belief toward a person that can lead to feelings of fear, anger, distrust, or avoidance. Stigma has been around since the beginning of time and can be very hard to change. There is profound evidence that stigma can stop a student from getting help with their anxiety. This is due to the 3 different types of stigma that surround GAD. The first stigma is known as a personal stigma. This type of stigma stems from specific individual personal attitude or faith about their condition. The second type of stigma is called perceived stigma and relates to an individual's opinion of how others think and feel about their condition. The third and final type of stigma is self-stigma. Self-stigma centers how an individual feels about their own condition. Personal and perceived stigmas are the 2 with the highest implications in terms of GAD in elementary students. Findings from Batterham, Griffiths, and Christensen found that perceived stigma had a bigger effect than personal stigma in students. Since extreme stigma can hinder the ability for one to come forth with their pediatric GAD, it is imperative to try and eliminate the stigma surrounding it. There are a few different ways this can be done. Public awareness is a big factor in eliminating the stigma around pediatric GAD in elementary school students. A pair of workers from a mental health organization started a business centered around literally wearing your disorder on your clothing. The business was started by Kaylee Reed and Kyle McNeven, and it is aimed to show that you can wear your disorder proudly. Was created to try and put a stop to the stigma surrounding mental health. One reason this business was started is because the owner, Kyle McNeven, had been managing GAD for quite some time. The sole purpose of the business, called Wear Your Label, is centered on propelling the negative undertones into the open. The clothing brand was designed as a tool to spark conversation about mental illness. The Wear Your Label clothing line is just one public awareness tactic and is not aimed directly at GAD. Public awareness can only work if people are also educated on what GAD and pediatric GAD is. Any chance an organization or school can use to educate the community on pediatric GAD needs to be done. There are some differences pertaining to GAD in general and pediatric GAD. Anxiety is prevalent in almost all ages, including elementary school students, and it is prevalent in all genders, sex, race, and ethnicity. Keaton, Colas, and Walkup found that GAD befalls roughly 10% of children. On average, begins at 8.5 years old and is reported in more girls than in boys. Research on pediatric GAD that starts before the age of 8.5 is lacking. To be specific, as stated above, children and adolescents were not eligible for GAD diagnosis until the publication of the DSM-4. Because of that, it is important to discuss sex differences pertaining to anxiety in adults. In a study conducted by McLean, S90, Brett, and Hoffman, no major differences in regards to sex were actually discovered. Although it was found that women who suffer from anxiety do have a higher risk of developing other disorders, such as eating disorders or depression. Since gender roles play a big part in anxiety, it may be easy to say that girls experience more anxiety than boys. However, a contradictory study done found that boys actually experience more anxiety than girls do. In the study conducted by Collier, it was found that boy students had higher personal stigma. Due to this, it is important to look into the sex and gender differences in terms of GAD. There are many reasons associated with the fact that boys may have higher GAD levels than girls, some of which may include lower anxiety literacy, less exposure to anxiety disorders, and no history of anxiety or depression diagnosis. A study done also found that boys felt more anxiety due to competition, lack of decision-making, concerns about stamina, and lack of support. In a study done by Chaudhry and Jain, it was pointed out that many factors help contribute to elementary school student anxiety, and some of those center on puberty, body changes, and different cultural experiences. There is not a lot of literature on race and ethnic differences in pediatric GAD. There is literature on adult GAD. It is important to understand the racial and ethnic differences in terms of GAD. In order to do this, adult GAD is going to be discussed. Since youth can become adults with GAD, it is important to understand both sides and where GAD starts to form. It was found that women in Latin European American cultures were hindered by more anxiety than the men in their lives were. A one-way analysis of variance, or an ANOVA, showed that there was no major difference in terms of age of onset of anxiety in boys and girls. However, there was a difference between European American and African American women. European American women had an anxiety onset of around 11 years old, while African American women started at 14 years old. This shows that there is a difference between some culture and ethnicities, but not much. So who can help? Parents are the first to look to. For quite some time, there was a lack of research on parental involvement in GAD. Recently, more research has been conducted and did find a link between the different types of involvement in GAD. It has been found that there are two specific types of parenting styles that make the biggest impact in students' pediatric GAD, and those are control and rejection. Parental control is defined as severe regulation of the student's life, encouraging dependence and parents instructing a student on how to think and feel. Parental control is also believed to enhance child anxiety by increasing the child's perception of threat, reducing the child's perceived control over threat, and withdrawing from the child from opportunities to explore the environment and develop new skills to cope with unexpected events. Rejection can also hinder a student's ability to cope with anxiety in that it fosters indifference. Criticism and hostility in the home are also symptoms of rejection. Rejection from a parental figure can also lead to a drop in the student's self-esteem, resulting in the child to constantly feel attacked and increase their sensitivity to situations. In recent studies, it was also found that parental control and rejection can have more powerful effects than that of positive parenting. This means that parental control and rejection have a stronger hold on pediatric GAD in elementary school students than positive parenting does. Parents play a very important role in what goes on with a student while they are not in school. Therefore, it is important to understand how their actions can affect their student. Many people make the assumption that mothers are the culprit and caregivers at fault for parental control and fathers are the culprit for rejection. It is also an assumption that mothers are the most important in terms of raising a child. These assumptions, however, are not always true. The reason that this is the main thought is due to lack of research centered on fathers. In a study conducted in 2011, it was found that mothers and fathers of clinically anxious children showed higher rates of controlling behaviors than mothers and fathers of children in a normal control group, suggesting that the associations between parenting and child anxiety are similar for mothers and fathers. Students who are dealing with pediatric GAD can have a hard time with inconsistent routines. Therefore, it is important for parents at home to have a clear set of expectations for their students. Consistency is an easy way to avoid confusion and the fear of the unknowns. The key question is, what can parents do to help their students who are trying to manage their pediatric GAD? They can help by encouraging their students to explore the world around them at a young age and by supporting their thoughts and actions. Parents can also help manage their students' anxiety by acknowledging that they do in fact have pediatric GAD. From there, parents can work with the school system to carry their students' coping skills into the classroom. In a study done in 2012, a reward or incentive program was presented. That same study stated that parents are more in tune with what their students will respond to, whether it be praise, stamps, stickers, or bonus recreational time. And this in turn can be helpful information for teachers in the classroom. Who else can help? Teachers. Parents are a very important tool when it comes to managing GAD in elementary school students. Are there more people out there who can help the parents? Yes, teachers. There are many symptoms a child may be exhibiting in the classroom that are caused by their GAD. These symptoms may not align with the classification of GAD, but they are a precursor for GAD. As noted above, students can feel they need to be perfect in all aspects in the classroom, and they can have an aversion to long homework assignments and have an aversion to tests and can lack the skills to communicate with others. So what can teachers do to help this? The answer is a lot. Teachers can work with these students to inspire brainstorming techniques, inspire time management skills, keep things as structured as possible, inspire students to hand in imperfect work with the hope of positive feedback for at least trying, allow for extra time on tests, avoid tests or homework with actual time limits, break a project into smaller portions, implore coping skills into their classrooms, such as deep breathing or counting to 10, keep a calm voice, make sure to address any bullying, and provide positive reinforcement for those who are reaching out for help. One teacher's tactic teachers can avoid to help manage pediatric GAD in the classroom is to avoid group and individual humiliation. Teachers are encouraged to handle student behavioral issues coolly and firmly. If a student does something wrong, it is best not to issue a classified punishment or to embarrass a student. Teachers are also encouraged to work with parents on reinforcement strategies and find out what works best for that student. So what are the current school and community-based resources? They are the Child Anxiety Learning Module, or CALM, the Friends for Life program, and the No Worries program. There are many different factors that contribute to anxiety, which means there are a range of solutions that can be put in place to help those overcome anxiety in elementary school students. Currently, there have been numerous programs tested and that have had success in terms of pediatric GAD. The programs that have been proven to have success are Child Anxiety Learning Module, or CALM, the Friends for Life program, and the No Worries program. It is important to take any course of action necessary to diagnose and manage GAD in elementary school students. Many solutions have been attempted with success, but take a collaborative effort from parents and students, teachers, nurses, and school administration to be really successful. The current resources available help teachers, families, and schools strategize and manage GAD in elementary school-age students, and those strategies include tests, learning modules, training, and assessments, and those are to assist teachers, nurses, and administration in managing and educating others on GAD in elementary school. One of the current solutions brought forth is centered on the Child Anxiety Learning Module, otherwise known as CALM. CALM is currently being funded by the Department of Education's Institute of Education Sciences, and it is directed toward nurses in the school system. The CALM method consists of 5 to 8 sessions that span over 8 weeks. The main point is to show nurses different ways to help students with their GAD. CALM is also an acronym. The C stands for calming down by the use of relaxation skills. A stands for the actions that can be used to help reduce anxiety. L is in reference to listening and paying attention to any scary thoughts or ideas the student may have. And finally, M stands for manage and how to work through a problem by using the learned problem-solving skills. Initially, nurses are given training by psychologists and learn a variety of skills. These skills include psychoeducation, general information on anxiety, information on how to recognize anxiety, behaviors, thoughts, and somatic symptoms, how therapy will help the students' anxiety, and how to properly identify somatic symptoms, and the proper way to teach a student to calm or manage their GAD. The first stage centers around a group of expert consultants, the Calm Development Work Group, or the CDW, who will provide detailed feedback about the CALM strategies, study methods and measures, perceived barriers to successful implementation of the intervention and adoption by nurses and school systems, and the solutions to those potential barriers. The CDW would meet throughout the time CALM was in place to discuss any protocol that needs to be adjusted or changed. The main purpose of Stage 1 in the CDW is to make sure CALM runs smoothly and does not leave the staff with additional workloads. The second stage allows for nurses to complete training on how to do proper interventions. Since nurses are in the perfect position to help students who suffer from GAD, it is important to find ways to help them train in the ways GAD can present itself. Stage 2 of the CALM method is in place to permit nurses a chance to test the interventions they are learning and see how they work in a real-life setting. After the trials take place, the nurses are expected to give feedback that will be given to the CDW. Once the CDW goes over the feedback and the results, they will revise the module and make any necessary changes. The third and final stage includes going over how this process did in reducing anxiety symptoms, severity, and improving academic outcomes. The second school and community-based solution that has been developed is a program called the Friends for Life program. The Friends for Life program is centered on preventative care for students who suffer from anxiety and uses behavior therapy. The Friends for Life program centers around teaching students how to recognize they are going to have an anxiety attack and how to calm themselves down from an attack, how to use encouraging self-talk, how to gradually expose themselves to their anxiety trigger, and how to reward oneself. The Friends for Life program showed lasting effects. Recent evaluation research on the efficiency of the Friends for Life program showed the effects of the lessons learned became stronger and decreased levels of anxiety for at least up to 12 months after the program was put in place. The same evaluation found that girls who participated more reported dropped anxiety levels. A major strength of the Friends for Life program is that it was originally tested in a school setting. The program was integrated into the students' everyday lives at school. The Friends for Life program is shown to have lasting effects, and this could be due to the students realizing that they are not alone in trying to manage their GAD. Having that support system and community can lead to students feeling more positive about their GAD. A TED Talk by Kelly McGonigal talks about making stress a positive thing versus a bad one. McGonigal talks about how stress can badly affect your body and can eventually cause heart problems. McGonigal also talks about how those effects do a complete switch when those who are stressed feel that stress is a helpful emotion. When people feel that stress was their friend, their bodies reacted the same way it would as if they were happy or feeling courageous. McGonagall's study supports the idea of the Friends for Life program, which is aimed at teaching students how to turn their anxiety into a learning experience rather than a hindering one. A third program that has been tested is called the No Worries program. The No Worries program is aimed to teach children about GAD and the intolerance of uncertainty, negative beliefs about worry, negative problem orientation, and cognitive avoidance, as well as symptoms commonly reported by children with GAD, including sleep difficulties and perfectionism. The No Worries program is designed to help students over 10 weeks with one session per week. What is unique about this program is that it is not just for the students, it's for the parents as well. The No Worries program is designed to inform parents of how to teach their children and themselves how to manage their GAD. What is also unique about the No Worries program is the term they use to classify anxiety. The program calls anxiety the worry beast. One main goal of the program is to not get rid of the student's worry beast, but to help tame it. The program emphasizes that everyone has a worry beast, and sometimes people need help calming the beast down. During the program, students are even asked to draw what they think their worry beast looks like and to write what he worries about the most. At the end of the program, they are asked to redraw their worry beast to see if it has changed. Since the program emphasizes that anyone at all ages can have the worry beast, it is important to discuss that this program has sessions for students as well as parents. The design of the No Worries program is to see the students and parents separately and on the last session join forces. The main purpose of the No Worries program, in terms of the students, is to target the issues with uncertainty, the negative connotations that follow their worry, and their negative problem-solving skills, as well as their cognitive averting. Since the No Worries program deals with an intolerance of uncertainty as well as GAD, it is important to understand the difference between the two, since they can get confused with each other. The concept of intolerance to uncertainty deals with the what-if situations and a student's worries. GAD centers more on personal responsibility and what the student is going to do about a situation. Many times, students who suffer from GAD are asked to give the worry back to the proper person. For example, if a student is worried about the doors to their home being locked, they can ask the parent to make sure that it is done so they do not need to worry or have anxiety over it. Another tactic the No Worries program teaches is to just let things go. If something is out of their control, they need to realize they cannot control everything around them, and they need to learn to accept that. So how can a 5-step process help? If the same creators of the Friends for Life program used McGonagall's approach to stress and anxiety, they could also teach students how to not only help themselves but help those around them as well. To answer the question, what can be done in the future, is simple. Combine CALM, the Friends for Life program, and the No Worries program. Following is a proposed 5-step process that aims to help manage anxiety, generalized anxiety, in elementary school students. The following 5-step process uses a combined method of the CALM method, the Friends for Life program, and the No Worries program. This proposed process aims to teach administration, teachers, nurses, parents, and students how to spot GAD, the proper steps to assess the situation, and provide the best course of intervention. The 5-step process uses ideas from the CALM method, the Friends for Life, and No Worries programs, and combines them into a program titled the High Five program. The 5-step process focuses on different tools and assessments that can be used to help manage GAD in the classrooms as well as at home. Step 1 would be to gather a sample group of about 5 elementary schools. Each school will have a head team consisting of the principal, main nurse, the school psychologist, and 1 teacher representative. This group will be responsible for scheduling the training sessions and for monitoring the success of the new process. In addition to monitoring the process, the head team will also be the head of the High Five program. A lot needs to happen for the student to be enrolled in the High Five program. The head team will first need to train their staff, the remaining administration, remaining nurses, and remaining teachers on how to use a select few scales and checklists. This will happen in step 2 of the process. The first tool the head team will train their staff on how to complete is the Revised Child Anxiety and Depression Scale, or the RCAD. The RCAD is a 47-item self-reporting questionnaire assessing the symptoms of childhood anxiety and depression. The RCAD centers on a scale for anxiety and a scale for depression. The second tool the head team will train their staff on is the Teacher Observation of Classroom Checklist, the TOCAC. This checklist is used by teachers to monitor specific students. The students that teachers will monitor are ones who exhibit concentration problems and behavioral issues. The third tool the head team will train the staff on, as well as the parents on, is the Behavior Assessment System for Children. This assessment is used by teachers, parents, and children to gauge how they are feeling about things such as school maladjustment, attitude towards school, attitude towards teachers, attention problems, learning problems, and study skills. Step 2 centers on the actual training session for the administration, teachers, and nurses. The training sessions are conducted in 3 sessions, one session for the RCAD and a second session for the TOCAC, and the final session will be centered on the Behavior Assessment System for Children. The first session will instruct the teachers on how to administer the scale in their classrooms at the beginning of each year. This training session will instruct the teachers on how to properly read the RCAD as well. In the beginning of the year, the students will fill the RCAD out and rate how they feel about each item and how much that item applies to them. Never, sometimes, often, or always. The second training session would involve a demonstration on how to use the TOCAC. The TOCAC will help the teachers sort out the students who need closer monitoring. The students who will need to be watched are those who score high in the 3 categories: attention problems, disrupted tendencies, and pro-social behavior. The TOCAC is a proven tool for teachers and elementary school students in grades kindergarten through 5th grade. The third and final training session would demonstrate how to use the Behavior Assessment System for students. This assessment will be used to also include parents as well as students. The assessment calls for parents, teachers, and students to respond to items using 4-choice responses format regarding frequency, behaviors: never, sometimes, often, or always. Step 3 involves the administration, teachers, nurses, and parents putting the training they learned into action. The RCAD will be handed out by teachers in the beginning of the year. The students will fill it out and will give their answers back to their teachers. The teachers will then sort through the RCAD and add the students who marked often or always on a list. The list will be considered the watch list and will be all of the students who need further intervention. The TOCAC will be kept in classrooms for teachers and in the office for the nurse administration to use. The TOCAC will need to be filled out for students from the watch list who is having trouble focusing, behaving well, and participating properly in the classroom. The nurses can fill one out when they see a student exhibiting extreme somatic symptoms on a regular basis. Finally, the third step will also focus on getting the parents of the students on the watch list and those who have a TOCAC filled out into the school to fill out their behavior assessment system for students. That will be used to determine if the GAD extends to more than just the students. In step 4, after all the assessments are made, it will then be the head team's choice on if the student and their parent needs to be enrolled in the High Five program. The school psychologist will be the key to step 4. The teachers will work with the school psychologist on the head team and create a plan of action for the student and their parent. The psychologist will also be in charge of making sure the suspicions of GAD are taken seriously. Once the head team looks through the assessments and checklists, they will meet with the student who are considered high risk. The head team will look through and see how those students' parents stack up on the assessments. If the students and their parents are both considered to be high risk, they will have an appointment set up with the school psychologist. The school psychologist will meet with the students and the parents to explain the High Five program and what the next steps are. It will ultimately be up to the student and their parent if they wish to be enrolled into the High Five program. If they choose to do so, they will be moved on to step 5 of the process. Step 5, and the final step in this process, its purpose is to make sure the students and the parents who are deemed at risk from the above assessments attend to the High Five program. The High Five program contains the greatest pieces from the before-mentioned Friends for Life and No Worries programs. The High Five program will include the coping skills that were contained in the Friends for Life program. The High Five program will also introduce students who have GAD to other students who have GAD. By forming a sense of community, it will help them feel like they are not alone in their anxiety disorder. The community aspect is great for parents as well. Parents who have students with GAD will also need a support system. They too need to feel like they have someone to speak to their different strategies and coping skills about. The High Five program will build on the Friends for Life program by integrating methods from the No Worries program. The important aspect of the No Worries program is centered around the familial aspect. The High Five program will use the same timeline as that No Worries program, 10 weeks with 1 session per week. The High Five program will take the strategies used in the No Worries program and expand them by coupling them with the Friends for Life program. The High Five program will provide students with tips and skills on how to calm down their anxiety and how their parents can do the same skills at home. The High Five program is designed to use all the endearing qualities of the Friends for Life program and the No Worries program and combine them into one powerful and effective program. During the program, the students will be taught to recognize their symptoms, how to relax, how to act when a problem comes up, and how to talk themselves down from an attack. The students will also be given the chance to connect to other students who suffer from anxiety. The hope would be for the students to support each other and form a community of care. The second portion of the program would aim to have those tips transition into their daily lives. The program will also include parents and will work to help them manage their own GAD as well as they can help students at home. One great benefit to the High Five program is the counseling that comes with it. The counseling is for the students and the parents. The counseling takes place once a week for 10 weeks. It acts as a check-in system and aims to stay updated with how the students and parents are feeling. The first 5 sessions will be with the students alone and the parents alone. The remaining 5 will be a combined session and aim to help the students and parents communicate together and understand each other better. The CALM method mentioned above taught nurses about psychoeducation, general information on anxiety, information on how to recognize anxiety, and how therapy will help the students' anxiety, and how to properly identify somatic symptoms. The difference between the CALM method and the High Five program it will involve the psychologist teaching these things to the students and parents in addition to the nurses. What is GAD and why is it a problem? Is there a stigma surrounding GAD? What are the differences in race, culture, and sex? Who can help with pediatric GAD? What school and community programs are currently in place to help students with GAD? And how can the High Five program help students manage their pediatric GAD? Pediatric GAD is a problem due to the fact that it can disrupt a student's time in the classroom, alter their peer relationships, and alter their personal relationships. Pediatric GAD also has the potential to grow with a student and follow them into adulthood. Since pediatric GAD is a new yet growing problem, it is imperative to remove the stigma surrounding it. Students who feel scrutinized due to their symptoms may not come forward with their stresses or concerns. Pediatric GAD does not discriminate and can affect any age, elementary to adult, any sex, gender, and any race or culture. It is shown that girls and boys feel GAD over different items and they are judged differently on how they handle it. Parents as well as teachers are in a prime position to help students manage pediatric GAD in the classroom. Parents have the opportunity to make their home life more stable and routine-based. Parents also have the ability to know what type of reinforcements their students need. Teachers are in the prime position to help students manage their GAD in the classroom. Teachers can make their classrooms feel safe and routine-based for the students who exhibit signs of pediatric GAD. Currently, CALM, the Friends for Life program, and the No Worries program have shown to have success. By grouping them together and forming the High Five program, the success could be greater. The High Five program will target school officials and students and their parents in hopes to find ways to manage pediatric GAD in the classroom. Pediatric GAD may be a new disorder, but it is not one that should be taken lightly. Any chance to research and formulate a plan to help educate, raise awareness, and manage pediatric GAD in elementary school students should be taken to heart.